Thank you. I'd like to just introduce myself, even though the gentleman so eloquently did. My name is Sabrina, and I am an HIV survivor. I use, thank you, thank you very much. I use that term with strength because in this time, in this day and time, I'd like for everyone to know that HIV and AIDS is something that you or they can survive. I'd like to start out this story with me being a person who didn't understand that I could be a survivor. You know, when I first got my diagnosis, it took me 11 years just to really understand what it is that they were saying that I was diagnosed with. I didn't particularly take on a position of trying to know what HIV was about, and I didn't particularly have that kind of care, from those doctors. I was diagnosed at a time when I was pregnant, and I went in for childbirth, and you have to stay in the hospital a few days. And while I was in the hospital for a few days, those persons were acting like that. And I was trying to figure out, why is everybody acting like I got a disease. But I soon found out. But they didn't give me any literature. They didn't give me any support. They didn't come and talk to me in a caring, loving kind of way, as if I would be here tomorrow. When I was taking my babies to those baby appointments, to get those shots, not even those nurses were really informing me about what was going on, So it was at a time when I had, like I stated, after 11 years, when I went into drug treatment. And after that, I went to stay at a woman's shelter. And those nuns that was living at that place, they introduced me to this organization called the Women's Collective. And from that point, and it was also synonymous with a time when I had decided, let me stop letting other people try to control what it is that I can do. I want to know about this HIV and exactly what it is, no longer feeling ashamed of it, no longer allowing other people to stigmatize me because I didn't know anything about it. I had stigmatized myself, thinking that it was something bad because of the way I was treated earlier. Now, at the Women's Collective, as soon as I walked into that organization, I was greeted with a hug. And I couldn't believe that, I don't know these people. All these women were just so happy to see me and, just glad that I had made that initial step to just come from wherever it was that I was, just to come there. So that's one thing that we keep as a tradition now. Whenever someone comes into our office, we greet them with a hug. Now, I didn't know at the time, but now I went there actually to get an outreach job, right? But at the same time, me being HIV positive, I was blessed to have an agency that offered me support and a job at the same time. How good can it get? So this agency was filled with other women who were positive, and I remembered at a time that was the thing that had sparked off that it was like a chain reaction in me. I said to myself, no longer will I sit around here remaining as sick as my secret, because I had chose to take this thing called HIV and make it a secret. I don't want nobody to know. But as soon as I decided to be courageous enough to speak up for it, that's when I got help. And as a result of the help that I've got, fast forward with the story, now I am a person who has been for 11 years helping others who are diagnosed with HIV. Thank you very much. And one of the ways that I can do that is through this agency that I'm speaking of. I'm talking about the Women's Collective. I have strategically placed a little brochure at everyone's place in an effort to give you an idea of what it is I'm talking about. Now, the Women's Collective is a woman focused, peer based, family centered organization. The thing is, when Patricia Knowles, years ago, when she found out her status and when she was diagnosed, this was maybe in the 80s. I would reckon at the same time that I got mine, the programs that were available at that time, they weren't really woman focused. You know, I remember going through uh, having to have, I wasn't always fit and up here like I can talk to you right now. When I wasn't feeling really well, I could only get food for me. They were only concerned about stuff for me. But here it is, I got 5 other children that I need to try to feed. I got 5 other children when it's time for me to go to my doctor's appointment. But at the Women's Collective, we offer child care for all of our activities that we have there, so that a woman would not be faced with trying to figure out how she can, what she got to do with these kids in order to make it to our coffee house, which is our support group, in order to make it to our advocacy meetings, which is the arm of our agency that has it's the arm of our agency that has the purpose to educate and to arm women with tools that they may use in an effort so that they may have a voice, so that they might be able to speak for their own behalf to legislatures and also to different persons, even in the community, to let them know what it is that they need and who else can you get it from other than the person that need it. We also have a prevention arm of our program, whereas we have a very small mobile van in which we go out into the community in all 8 wards and we test persons in their neighborhoods right where they are. Because sometimes you may have a person who lives in a specific neighborhood, they not going nowhere but to the corner store or maybe around the corner, to something like that. They're going to stay right in that same parameter. They may not get out and do things pertaining to their health, or they may not even come out to get an HIV test. So we go right to those neighborhoods, very skilled persons that are on the van that offer counseling. After we test a person, we make sure that we counsel them as far as their risk behaviors are concerned, so that if you test and are not positive, that you know what you have to not do or what you have to do to remain negative. We also at our agency offer different kinds of support programs. One of them is called Willow, whereas we have women who are positive and we get them to meet together in an effort to gain skills in which they might be able to use in their lives dealing with everyday kinds of things, because believe me, it's really not easy, just trying to have that decision to make as to whether you're going to disclose to your family about what's going on with you. Sometimes it's not so much of you feeling ashamed about it. It's really trying to premeditate what their reaction might be. And you may not be ready for that, So we offer them ways in which they can increase their support network, meaning that if they have this issue pertaining to disclosure, they can talk with someone in an effort to get them to support them in the things that they have to do. Sometimes it might be as simple as asking someone to assist you in going to the grocery store, and we give them this information in an effort to get them to not be isolated, because sometimes women have a tendency to get isolated in their demeanor or in whatever their situation might be. When we say we are peer-based, we have women who work at the Women's Collective, like myself, who are positive, who can lead these women through these kinds of endeavors because they've been there themselves. So, and sometimes you may have a person who might not want to listen to somebody who looks like they might have a degree here, or they may even talk like, they don't know what it's like living in a community where you have your neighbors and other people not understanding because they're not educated about HIV, thinking that it's something they don't even know how it's transmitted. So they might not even want you knocking on their door or touching their doorknob. And they say really, really nasty things. You even if you don't bring a conversation up about it in a way as if you're disclosing, you can kind of hear, or overhear, conversations just by walking past certain groups of people as to their positions, on things like that. So we serve to help educate the community also in areas like that in an effort to reduce the stigma. Now, one thing that I'm very, very grateful about is right now at the Women's Collective, I am in training to be what's called a community health worker. And what that entails is even though we have all these services here for these women, we still have some persons who may not, what you might call, buy in. They may not still understand that they need to take their medicine. They need to remain adherent. They can come to each and every coffee house. They can come to each and every other kinds of activities that we have, educational sessions. But they may be coming for all the wrong reasons. So what I do as a community health worker, I will talk with these women because you can look at or medical, like your blood don't lie, so you can look at their lab work and you can tell if a person is doing what they say that they're doing. So I make efforts to encourage them by example and by communicating with them in a way that they understand. Sometimes it may not always be so nice and pretty. Sometimes you might have to snatch their head back, if that makes sense. Not in an effort to pull or hurt a person's feelings, but when you have love that you speak to a person with, it's all good. So it's my job to identify these persons and to speak with them in a confidential manner, letting them know what the importance is. Because more times than not, I have experienced, and it's not really, really good, and it's not a good feeling, that sometimes these women, they don't say a word. And the next thing you know, they passed on. And that's really, really sad when you got these tools here and you got all these services, whereas that's not the choices that they have to make. One thing else I'd like to say about the Women's Collective is that at one point we had a very small space. And over the years, I've seen this organization grow and get larger. Even in the small space, I think they knocked the walls out and we had more offices, and then we were able to get more agents, more arms of our agency, and we were able to provide more services, And as time went on and on, like even right now, because of the economy, some of those services are being cut, and it's affecting our agency also. But right now, we're fighting and really struggling to keep as many services as we possibly can. I'm very fortunate to be a community health worker, whereas I can refer persons out into the community as to get some of these services that they need. But we do have some clients who may not have transportation, to get there. So we do have a very, very strong need for more services at our agency. I am also happy to say that we as a agency have been able to have some of the women who are medically case managed to become what you call self-sufficient, to come from a place where they didn't understand about how to use their medicines and how to manage, getting to the doctor on time, to be able to learn how to do that and to become self-sufficient. And we've held a graduation for them. So we are making progress, and we have been able to clear those caseloads, whereas we can take in more and more women. I like to also mention, I didn't mention it at first, we're the only woman focused agency in Washington, D.C. that deals with this issue. Thank you very much.